Hello everyone, welcome to today's rotation and review video for psychiatry. The first part is going to be about the clinical component. I'm going to cover what expectations they had of me, what responsibilities I had, my hours, and just a day in the life of what I had to do. So the second part of this video is going to cover how you'll resources that are sufficient in adequately preparing you for the shelf exam and also for the psychiatry portion of the Step 2 exam. And then the third component is going to be how to get a good evaluation from your preceptor, what things you should do, what things you shouldn't do. And lastly, we're going to cover my advice for future students. So if you're going to be starting your psychiatry rotation soon, what you can do to prepare for it and how to prepare yourself adequately to excel in both the clinical component but also the knowledge aspect of the rotation. So let's get into the video. So the first part of the video is going to be an overview of the rotation. I'm going to have my iPad with me, so if I look down occasionally, you'll know what it's for. So my rotation was a mix of inpatient and outpatient. You're going to see different kinds of disorders and presentations of patients in different settings. Usually for inpatient, for psychiatry, it's a lot more of the emergencies, a lot of the more hectic, chaotic cases, and outpatient is a lot more relaxed. So I got to see a bit of both and a typical day schedule and responsibilities of mine. So for me, it was a classic 8 to 5, 8 to 6 sometimes. And the responsibilities that I had kind of changed throughout the rotation. At the very beginning, as I told you guys in the rotation videos, there were very few expectations of me because I was very new. I had to learn the system. I had to learn how to chart for patients, how to document, and how the clinic or the hospital really works. So for the first week or two, I got to know how everything works and there weren't many expectations of me. But moving forward, the responsibilities kind of increased with time. And these included, number one, I had to learn how to admit new patients. So you got to take them through a very thorough psychiatric history, their family history, a social history, a medical history, and you got to get a whole history of the patient. You got to know everything about them that there is to know. The second part was performing a mental status exam. So a lot of this was assessing their behavior, how they reacted, their mood, their affect, etc. You had to know how to conduct this assessment with patients that were new, and even for those who were following up. So the third responsibility that I had in my experience was conducting the Montreal Cognitive Assessment exam. And for this assessment, basically, you're trying to see subtle declines in cognitive ability. And this is very important for differentiating whether a person's cognitive abilities are slowly declining or not. And you track this with time for different conditions. So the fourth responsibility that I had, and this took the most time, was documenting patient encounters and charting. So you would have to write admission notes, progress notes, discharge summaries in SOAP and HMP format at different times. So a lot of times you would see a patient and then you would conduct the interview or it was a follow-up. And then you write your own assessment of what's going on, how the patient has been, and then a treatment plan or a discharge plan. And then you run this by the attending or the person supervising you, and they give you feedback on whether you are right, what you are wrong, what you took note of correctly, what you didn't take note of, and how that would contribute to changing the assessment plan. So this was one of the responsibilities that you were given, and that was kind of expected of you as time went on. So as for my rotation, I think I actually enjoyed it. I think it was a very eye-opening experience. You got to see people from different walks of life, and it really humbled you. And it really broadened your scope of empathy when it comes to how you view people, how you perceive people, and how you treat people. You really don't know the levels of tragedy and trauma and sorrow and difficulty that people have to endure on a daily basis and how that impacts their behavior, their outlook on life, and so many different things. So this psychiatry rotation, I think it's very essential. I think every single medical student should actually experience it because it really humbles you and it instills a lot of humility and empathy in how you view others and how you treat others. But at the same time, it was very emotionally draining for me. There was a lot of times where I would go home from the clinic or from the hospital and I can't help but feel so drained, and not in a negative way, but because I felt so horrible from seeing the difficulties and traumas people are enduring on a daily basis. On one hand, it did make me feel very grateful for the life I've been given, for the privileges that I've been given because of the hard work of my parents and my upbringing, etc. But at the same time, I was very upset over a lot of the living circumstances that other people had. And almost all of the time, it was not even within their control. They had to endure it, whether they liked it or not. And to this day, I remember a lot of the patients that I saw, and it kind of bothers me and it hurts me. It's like a lot of human grief that you carry with you. Even when you go home, you think about the patients, you wonder, have they gotten any worse? and it is very draining on you. And I wouldn't want it any other way. I think that's a very human part of medicine. I wouldn't want to be desensitized to it. I don't want to see human suffering and grief and not feel anything and to let it just go through me. I want it to affect me. I think that's what makes us human beings, and that's what helps us be better doctors for other people. But I can't help but feel very drained, and I don't think psychiatry is for me for that particular reason. As much as I love it, as much as I enjoy it, it is very draining for me, on me emotionally, mentally, and spiritually even sometimes. So this is how the rotation is and what to expect. Obviously, a lot of people are attracted towards that part of medicine, that part of psychiatry, and kudos to them. I could never do it. I wish I could. But for me personally, given how difficult it is emotionally and mentally, I just don't think psychiatry is for me. All right, guys. So now we're going to cover how to prepare for your shelf exam and also for the psychiatry portion of your step 2 exam. So for step 1, there are dozens of resources that you can use, and sometimes that becomes overwhelming. You don't know what's good to use, what's not good to use. But for step 2 and also for your shelf exams, it's a lot more straightforward. When it comes to step 2 and also for your shelf exams, there's only 2 components that you need to excel in those areas. So the 2 components you need is number 1, a question bank, and number 2, a tool which allows for active recall and spaced repetition. For the first component, you need a question bank, and the question banks that are very credible and reliable for step 2 and shelf preparation are AMBOSS and UWorld. Honestly, it just comes to personal preference which one you use. I don't believe there is any objective superiority of one tool over the other. I personally used UWorld, and what I did is that I saw the number of total questions there are for psychiatry, and I think there are 300 and something questions, and I asked myself, how many questions can I do every single day and create flashcards for those questions without feeling burnt out or drained? Because honestly, step 2 preparation and also third year of medical school, it is a marathon, it's not a race. You don't want to burn yourself out. And the answer to that question for me personally is 30 questions. So every single day I did 30 questions and I got through my entire question bank, I think within the first few weeks of the psychiatry clerkship. And then the second component, as I said, is spaced repetition and active recall. You want to make sure that you're solidifying the concepts that you're learning and you're integrating it into your long-term memory and not just short-term memory. Because you might learn a concept and in that moment, in that day, it might make sense to you. But if I ask you about that in a week from now, in 2 weeks from now, in 3 weeks from now, you're likely not going to remember it unless if you have a tool for active recall and spaced repetition for that. So for that, I used Anki. Now, there are other resources that you can use like videos. Honestly, for me, that wasn't really helpful, and a lot of students say a question bank is all you need. The one benefit of a video tool is that it might prepare you for the question bank. So a lot of times, even for myself, if you go straight to the question banks, because you haven't prepared for step 2 material, you're going to have a very steep learning curve, and that might be very demotivating. So maybe if you watch videos, it might prepare you better so you score better starting off and your morale is not going to get crumbled. But generally speaking, the 2 resources that you need for step 2 preparation and your shelf preparation are just a question bank and active recall. If you want to overkill this, the only third component that I would personally add to this are CMS forms. CMS forms are basically NBME forms that are subject specific. I did them myself personally because I had time, because I finished the question bank, I think, with 3 weeks left in the rotation. So I did the CMS forms, I created flashcards for them, and I also redid my incorrects as well. And I found that to be very helpful. So in summary, the 3 components you need, or actually 2, for step 2 preparation and also for shelf preparation is number 1, a question bank, number 2, a tool for active recall and spaced repetition. And for that, I think Anki is the best tool. And one day I think I'll create a video for how to configure your Anki's algorithm and how to create flashcards that are most helpful for testing concepts for yourself. And a third tool, if you want to overkill, I would say the CMS forms, but a lot of people leave those off when they want to take step 2 and they want to prepare for step 2. So that does it for preparing for the shelf exam and also for the psychiatry component of step 2. And next, we're going to move on to how to conduct yourself in a way that secures for yourself a strong evaluation for your clerkship grade. Alright guys, and now for the last part of the video, I thought I'd give you guys a change of scenery. I feel like I've imprisoned you guys inside my room for far too long. It is quite windy, as you guys can see, but hopefully the wind isn't too bad. So for this part of the video, we're going to be talking about how to get a good evaluation for your clerkship. The clerkship grade that you get is going to be a combination of both your shelf exam and also the evaluation you get from your preceptors. And also, when you apply for residency, you're going to need good letters of recommendation. And if you have no doctors who like being around you, you're not going to be able to get those letters of recommendation. The first thing you want to make sure you do is just be a good human being. So honestly, it's very simple getting a good evaluation. Doctors aren't expecting you to be a psychiatrist in the psychiatry rotation, or a pediatrician in the pediatrics rotation, or a surgeon in the surgery rotation. They just expect you to be an agreeable person, a hardworking person, a professional person, a person who is easy to be around. You don't want to be obnoxious. You don't want to be pretentious. You don't want to be a student who tries to one-up other students, because that sticks out. And before I started my rotations, I would hear this a lot, that, hey, just don't be a jerk. It's that easy. And I would think to myself, that's kind of common sense, isn't it? And then I entered my rotation, and then I noticed that, well, that's not the case at all. There's a lot of students who interrupt each other in front of the doctor to try to impress them. They interrupt the doctor, try to tell them what the diagnosis is or what the treatment plan should be, trying to impress them. And almost every single time they do this, it makes them look very horrible. So the best thing you want to do is just to be a good human being. Be patient, be hardworking, be professional, and be very malleable. The one thing you want to make sure you do is have a moldable personality and behavior. So if the preceptor and the senior that you're with is a very extroverted person, he wants to cuddle you, he wants to always engage in conversations, you want to reciprocate that personality and that vibe, right? You want to ask a bunch of questions. You want to engage in conversations. You want to say, hey, I read this research article about this case. What do you think about A and Z? You want to do this to stand out to this person. Obviously, don't fake things. Don't try to be something you're not. But it's good to be able to mold your personality to make other people feel comfortable around you. And on the other hand, if your preceptor is very introverted, he hates you being there, he hates having to teach you and answer questions, you want to reciprocate that. You want to reflect that kind of attitude and behavior that he has. And I've experienced that, right? I know when to ask questions. If a person is very busy, he's going from room to room, from operation, from patient to patient, you don't want to be asking unnecessary questions. You just want to ask, hey, what are your expectations of me? What do you want me to finish by the end of the day? And have those finished. And that's all you want to do. You want to stay out of the way, hopefully not even make him notice you. And that's honestly a very good tactic to have. The next important point is to be able to nail your presentations and know your patients inside and out. Obviously, your supervisor, your senior is not going to expect you to know the treatment plan that is indicated for a patient. That's not realistic, right? But what they expect you to know is to know everything about the patient that I've given you, right? So if it's their medication history, if it's their social history, anything which is relevant, even if it's slightly not even relevant, try to know everything. And that will definitely help you stand out a lot. And the last point I want to mention is you want to be a functional medical student. You want to be a person who gets tasks done, and even if you don't know how to do it, you volunteer and you're eager to know. If the doctor wants you to scan something, if they want to get a consult, if they want to do anything, you volunteer for it and you get it done well. If you get this done, this is actually a very underrated part of the job, especially in contrast with students who are very shy, they're very reserved, they're scared of messing up. If you volunteer to do stuff and you learn how to do it, the doctor will definitely have a lot of relief on having you as part of his team. All right, and now for the last part of the video, for future students, what advice do I have for them? So the first thing you do is nothing. You don't have to prepare for your rotation by doing UWorld or Anki or anything else. You don't have to do anything because you don't want to burn yourself out. There's enough time for you to learn whatever you need to learn on the clinical aspect part of it, but also for the knowledge aspect of the rotation. So if you don't do anything and you take time to just relax, to recover from a previous rotation, that's perfectly fine. But if you want to prepare for it because you're very anxious like I am, there's different things you could do. So if your weakness is the clinical component of the rotation, then you could start familiarizing yourself with the tasks and evaluations and assessments and different responsibilities that you will have on the rotation. And I referenced them at the beginning of this video. Now, if your weakness is the knowledge component of it, then you could begin with UWorld or with AMBOSS or even Anki. There's a lot of pre-made flashcards that you could use and start doing to familiarize yourself with the knowledge aspect of a rotation. But one thing that I would do personally is I would just focus on learning about the common medications and common medical conditions that we're going to be diagnosing in the rotation, and knowing a lot of the nuances between the different class of the drugs. So even within the same class of drugs, if you want to get prescribed an SSRI, if the person they're overweight, right? or they have a certain indication, it's good to know the nuances between different drugs. Which one would you give over another drug? So that's also another thing you could do. You could avoid UWorld and Anki and just focus on learning about the common medications and the nuances between different medications within the same class. And if you don't do anything, that is perfectly fine. So anyways, I hope you guys benefited from this video. The next video I will be posting is my pediatrics rotation. And if you guys have any questions regarding a person just passed by, and I'm pretty shy, I don't know how to do this. But if you guys have any questions, feel free to leave them below. And I'll see you guys whenever I see you guys. Bye-bye. I don't know why I'm waving. I don't know how to sign out. So I'm just gonna